Welcome back to the Morning Blend. Botox and fillers. One helps us relax our frown lines. The other helps us add volume as we age. And both are great tools to help us look younger. But there are other advanced and unexpected ways to use Botox and fillers.
And joining us now with more is Dr. Mary Fox and Lisa Thomas, a physician's assistant with the Wisconsin Vein Center and MediSpa. Thanks for being here, ladies.
Yes.
Thanks for having us.
All right, so we're going to spill the beans. We're going to give away all the secrets, how you can use Botox and fillers in other ways than just the typical things we think of the forehead and, you know, kind of the eye area. So, but that is one of the main things that you still use it for, right? Is the forehead, the expression lines.
Correct. So like between the eyes, the crow's feet, the forehead, those are the typical places people think to use Botox. In addition to that, we can use it on the upper lip and lower lip to help soften lip lines. We can additionally use it to help elevate the corners of the mouth by relaxing two small muscles on each side of the mouth.
Because some people have that downturned smile.
Yep.
What about, you know, it kind of just droops or it goes downward.
Yeah, it's just a slight raise, but it just helps to soften up, especially if you get depletions down here, the marionette lines. Just it's nice to use in conjunction with fillers in that area.
And what
too.
about the dimpled, puckered chin? You can relax that as well, right?
We can. So in the chin, you have a mentalis muscle, which is the muscle that kind of, as we get older, we use it a lot when we're using our mouth a lot. And you get, we call it a peau d'orange, or a dimpling of the chin, and very small amounts of Botox will soften that up and make it smooth out.
So these are more wrinkles, not in front. I don't know another term, but it's not like the butt chin. I don't know.
No, it's not. It's not like it's not like the butt chin. It's dimpling. It looks like an orange peel.
So it's an age thing.
It's an orange peel and
like that.
appearance. Yeah.
It just
Yes.
helps. There you
Is there
go.
a medical word for the term butt chin?
I don't know what.
Cleft.
That right there is what you can fix.
Exactly.
Okay. Yeah, I'm not going to demonstrate that again. Thanks for the tight
And in
shot.
addition, one other area is as we age, we have platysmal bands or lines, vertical lines on the neck that become prominent. Those can also be softened with Botox.
What about the bands, the neck bands? I got one big one.
A little bit, yes. You can also do those.
A little bit. I love it. What about, I did not realize that it can also be used for people, because I am a clencher at night, and you can do something for that as well as people who have TMJ problems, right?
Yes.
And that's huge, and that's sort of new what we're doing. That masseter muscles are these muscles, when you clench, you can see them kind of stick out a little bit.
Yeah.
But some people have really prominent masseter muscles that are just always sticking out. But people that grind their teeth at night, that clench their teeth at night, that have a lot of pain around their ears or in that TMJ joint, we're injecting Botox in that area, and it relaxes those muscles. And over time, it breaks that habit. So we're doing it about 2 to 3 times, and we're seeing really great results from that. The other thing that it does is it actually thins out your face, which is just kind of a nice addition to
that's
aesthetically
awesome.
pleasing. It kind of softens up the edges of the face, especially if you have a little wider jawline.
Okay.
How about the eyes? I know that's another area that you can use it if you have kind of that eye hollow area.
That we use more filler.
The fillers.
Yep,
Okay.
filler
Okay,
in
and
the tear troughs.
Back to Botox,
Yes.
just really quick. You can do the excessive underarm sweating, right?
Yes.
You can treat with Botox.
Yes, hyperhidrosis, we can do it of the hands.
Okay.
People get really sweaty hands, as well as the underarms.
Oh, for the hands
You
too.
can do it
That's
for the hands,
interesting.
too.
Okay. And then Tiff mentioned fillers. So it's a lot of times we think of them for right here, this fold that comes down from the nose, right?
Yep. The nasolabial fold. Yep.
Yep.
Much more now, what we're doing with fillers is we're trying to get a more natural look. So when we're aging, we start out kind of, when we're younger, we have more fullness in our mid-face, and as we age, we get more of an upside-down triangle, so we get more fullness down those. So what we're starting out doing is just doing more filler in the cheeks and in the temple area, and we're having to use less filler down low. But we still do a little bit of filler down low to fill in where we need to after we've done the cheeks and the mid-face. And we can do, like you were describing, tear troughs or underneath the eyes where you get the hollowing of the eyes.
That's awesome.
It is. It's very cool.
Because that's an area that I would think once you lose volume, it's tough to do much about. Because you think about different creams and stuff, it's not going to do a lot there.
Correct. Yes.
Eyebrows, that's another area.
Yes, we can do some eyebrows to lift up the eyebrows a little bit. Doing the temples will also lift up the eyebrows a little bit.
And right now you also have a special through the end of September as well.
We do.
Yeah, so through the end of September, filler, any site, if we do one site, an additional site, we are offering $100 off our already discounted second syringe price.
So this applies to both Botox as well as fillers, right?
And then the Botox discount is, so the first 25 units are at the regular $12 price, and then any units after that are $10 a unit.
So how many units does it take, say, to do, generally speaking, the forehead area?
Typically we do 25. So
Yeah,
right in the
20 to 30.
mid-face glabellar area, we'll do 25, and then we do about 9 and 9 on each of the crow's feet, and then it varies up here depending upon what your wrinkles are like.
Okay, awesome. All right, so here's more information. Anyone who has filler in more than one site, they'll receive $100 off their already discounted second syringe price. And then if you receive Botox to more than one site, you will get the $10 per unit pricing after the first 25 units, which is at $12 per unit regular price. You can call the people at the Wisconsin Vein Center of MediSpa to find out, get a consultation, find out what's right for you by calling them at 262-746-9088 or go to wimedispa.com. Great to see you guys. Have a good weekend.
Thank you for having us.
Thanks.